You fastened your seat belt before driving your car to avoid an accident. Similarly, to avoid an accident during ECG interpretation, always make sure that the two basic ECG settings are correct. Number 1. Height of this calibration mark must be equal to 10 millimeters or 10 small boxes. Remember, in ECG paper, one small box is equal to 1 millimeter. In terms of voltage, one small box is equal to 0.1 millivolt and 10 small boxes are equal to 1 millivolt. So always look for this setting 10 mm per millivolt. Also remember that in 12 lead ECG there are 6 limb leads, that is lead 1, lead 2, lead 3, lead AVR, lead AVL and lead AVF, and there are 6 precordial leads, that is V1, V2, V3, V4, V5 and V6, and this calibration mark of 10 millimeter height must be present before these limb leads as well as before these precordial leads. If it is high or low here but normal there, that is a wrong setting. If it is high or low here but normal here, it is still a wrong setting. So always make sure 10 millimeters per millivolt before the limb leads as well as 10 millimeters per millivolt before the precordial leads. And other important setting is 25 mm per second standard ECG speed. Now the question is why this is so important to note. This is ECG of a 50 years old male who presented for routine checkup, and this is a normal ECG with a heart rate of 80 beats per minute. ECG of same patient, is this bradycardia? No. Here the ECG paper speed has been increased to 50 mm per second. ECG of same patient, is this tachycardia? No. Here ECG paper speed has been decreased to 10 mm per second. Now another important concept. The height of calibration mark must be equal to 10 small boxes and it correlates with the amplitude of QRS complex, and this is the normal standard setting. In example B, the height of this calibration mark is less than 10 small squares, and look at the QRS complex amplitude, it is abnormally low. And in the third example, the height of calibration mark is more than 10 small squares, and now look at the QRS complex which is abnormally high. Look at this ECG, amplitude of the QRS complex is high. So is this left ventricular hypertrophy? Is this right ventricular hypertrophy? No. Actually, the height of calibration mark is more than 10 small squares. That's why the amplitude of the QRS complexes appear abnormally high. Now this is a patient with left ventricular hypertrophy. Here you see amplitude of the QRS complexes is high and ECG has been recorded at the standard setting and height of the calibration mark is equal to 10 small squares. Now look at this ECG. There are low voltage QRS complexes. So is this pericardial effusion? No. Actually, ECG has been recorded at low voltage and height of the calibration mark is less than 10 small squares. This is a patient with pericardial effusion. You can see low voltage QRS complexes and ECG has been recorded at standard setting. That's why the height of calibration mark is equal to 10 small squares. So by the end of this lecture, now you know that before you start ECG interpretation, it is extremely important to have a look at the ECG paper speed and voltage, because as the ECG paper speed or voltage is changed, diagnosis on ECG can also be changed.